Good afternoon, everyone, or evening, depending on where you're joining us from. My name is Ruben Gonzalez. I work in the EFMP Central Cell, Marketing and Outreach Office. I'm going to be your facilitator for today. Welcome, everyone, to the 25 October 2023 EFMP Connect. Today's conversation will be Department of Defense Respite Care Standardization. Our speakers for today will be Ms. Sharon Thompson, Community Readiness Programs Consultant, Headquarters Air Force, Airmen and Family Care Division. Ms. Tammy Hern, Director, EFMP Central Cell, Air Force Personnel Center. And Ms. Ashley Martinez, EFMP Respite Care Liaison, Medical Branch, EFMP Central Cell. Without further ado, Ms. Hern, over to you, ma'am.
Well, good afternoon. Good morning, everyone. Thank you so much for spending some of your day with us. Today, we are glad to connect with you to talk about the respite care standardization that is going on. We certainly want you as families and stakeholders to be fully aware of the decisions that have been made, and then how the Department of the Air Force will execute and implement them. Certainly, today is a topic that is going to significantly impact our EFMP families and those receiving respite care. So again, thank you for spending some time and joining us to get all the ground level information on what is going on. Your feedback is super important to us. Certainly, all of the EFMP transformation efforts over the last 3 years have been founded on family feedback. So we're happy to be connected with you and certainly look forward to hearing from you. So today we're going to get to talk a little bit about respite care, why the change, what the respite care program looks like today and what it'll look like in the future. We'll look through what the application process includes and what that package, what type of information you're going to be sending. And then just to answer some questions, answer session, we want to really address what's on your mind and provide any type of clarifying information that we can. The EFMP transformation efforts began back in 2020, right? We were invited to some congressional hearings, and certainly families, family advocacy groups, and the military services were all there to discuss the gaps in EFMP services, as well as the inconsistent implementation of EFMP services across the military departments. So great conversation. We certainly were all enlightened by the things that we were not doing to help families, or the things that we were doing that was frustrating our families. So it began a great dialogue between the Department of the Air Force and our EFMP families. So again, thank you for being with us. Ms. Thompson is ready to go. She's going to really talk to us. She is our POC who represents the Department of the Air Force to the Department of Defense. So certainly our policy leader, ma'am, are you ready to go?
I am. Thank you, Ms. Hern. So again, good evening. I am glad that you decided to join us today. There has been a lot of discussion for some time about respite care, what a standardized benefit would look like across the services, how we would accomplish that, and the impact that standardization would have on DAF families. Before we really get into our presentations this evening, though, I want to talk to you about what respite care is and is not. Respite care is a benefit that provides temporary relief to family members responsible for the regular care of eligible dependents with special needs ranging from moderate to severe. It is not child care. So as we are talking about this this evening, again, kind of keep that in mind. That was something that we felt like we maybe should have gone into more detail with this morning. So when we talk about why the change, historically, every branch of service managed their respite care program, resulting in different processes, different requirements, and even different benefit levels, which ultimately led to gaps in delivery, inconsistent availability of support, and varying family experiences. As a result, of the 2021 National Defense Authorization Act, the NDAA that we have up there. That directed standardization of key processes and procedures for the EFMP to reduce gaps between the services and offer an equitable experience for all military families. The Department of Defense directed the standardization of the program across all military services in the Department of Defense Instruction, or DoD 131519, the Exceptional Family Member Program. The DoD implements the congressionally directed standardization. The Office of Special Needs provided implementation guidance in August of 2023. Implementation of the standard respite care benefit will be phased in and requires major changes in the way that we do business. The first phase included training of staff for those who will utilize the standard rubric to determine eligibility for respite care services, EFMP family support coordinators, and our services respite care staff. We'll also be meeting with DAF respite care providers in November. We are currently in the second phase, working with installation EFMP family support coordinators as they contact families currently eligible for respite care to assist them through the revalidation or the recertification process of their respite care eligibility, to answer questions. And please remember that they are a local resource and an advocate for you at all times. Every DAF family will know their eligibility status as required in the implementation plan, not later than the 1st of March, 2024. The third phase starts on the 1st of March of 2024 and provides a 12-month period of time for us to work with families to navigate additional resources and mitigate any negative impact. So the bottom line up front, to give families time to plan, those currently receiving respite care who validate their eligibility will continue to receive benefits at their current level until February 28, 2025. Revised benefit levels are not effective until the 1st of March, 2025. Most importantly, our approach has been and will continue to be every family, everywhere, every day. Our focus is on you, and we will continue to communicate with you throughout the entire transition. Next slide, please. So we want to look at our current versus future state. This is a snapshot of DAF respite care benefits pre and post standardization. Respite care benefits post standardization, or March of 2025, will look very different for not only our families, but for all military families. As you can see, currently respite care is not standardized across the Department of Defense. What does that look like? DAF families were enrolled when identified with moderate or severe requirements. Sibling care was authorized. And by the way, DAF was the only service that provided sibling care. Adult respite care is not provided currently by DAF. However, the Army and the Marines have provided adult respite care. 40 hours of respite care has been allocated per month per EFM for DAF families, with no distinction made for severity of condition. In comparison, the Marine Corps provides 20 hours per month per family, and the family pays for respite care up front and are subsequently reimbursed. The Army provides 25 hours a month per exceptional family member, but if you received respite care benefits through any other program, you were not eligible for Army EFMP respite care. So clearly families had very, very different experiences. Per the EFMP Standardization Implementation Plan effective March of 2025, respite care benefits will be standardized across all military departments. Standardization includes a standard respite care benefit, that would be talking about hours, which we'll talk about in just a minute, and a standard mechanism or tool for determining eligibility for EFMP respite care based on a family's unique and holistic needs. That tool is an age-specific level of need rubric. Sibling care is not authorized, and adult respite care is authorized for a level of need 4 only. Now, again, new for the DAF, but an area that generated several questions this morning. So adults who are identified as level of need 4 have family members who provide regular care for them, for the adult. Respite care is for that family member. Again, respite care is not child care. Examples that were provided this morning included an incapacitated adult child, or let's say a spouse with cancer. Again, for the Air Force, this is an opportunity for us to provide additional support to this group that we have not been able to assist in the past. So we look forward to that. When we're looking at the hours, families identified as level of need 1 and level of need 2 are not eligible for EFMP respite care. Families with dependents who require more assistance with daily living and are scored at the highest 2 level of need categories, which would be level of need 3 or level of need 4, are eligible for EFMP respite care. Level of need 3 will receive 20 hours per family per month, and level of need 4 families will receive 32 hours per family per month. Ms. Martinez, over to you, please.
Thank you, ma'am. Good afternoon, everyone. I'm going to go ahead and have you go to the next slide, Mr. Gonzalez. As we look at the new standardized program, we have 3 primary stakeholders involved. We have your installation EFMP family support coordinator and the EFMP central cell who work alongside you during the recertification and application process. Air Force Services, DAF, Child, and Youth work with you after you get the level of need determination and we're offering this actual service. Your family support coordinator is your primary point of contact for all things related to your application and submission of your application. In the next slide, we're going to kind of talk more in depth about what that application process looks like. The EFMP central cell is responsible for reviewing and determining the level of need of the exceptional family member. Again, Air Force Services is responsible for all things related to the delivery of respite care services. They will work with you to provide respite care provider listings, assist with scheduling services, and execute monthly payments. Now let's take a look at the in-depth process flow. So on this slide, we have 2 categories. I'm a very visual learner, so this slide kind of lays it more clearly out for me. The top bullet is for families that are currently eligible for respite care services, though they may not be receiving the service. The bottom is for all new families that are applying for respite care services for the very first time. They are very similar, but I'll point out the differences as we go. So you as the family will visit your family support coordinator to receive the respite care recertification info and application. We'll go more in depth about the application package next. You then take that respite care needs assessment to your medical provider who will complete the form. Once that's done, you then take the form back to your family support coordinator who submits it to the AFPC medical branch. At this point, if you have recertified, you will continue to receive legacy benefits to include the sibling care until 1 March of 2025, regardless of what level of need your dependent is. AFPC determines the level of need and then will notify services as well as your family support coordinator who will communicate that determination back to you. Right now, we don't have a clear timeline as to how long it will take us to get the determination back. However, we will notify all families no later than 1 March 2024. 1 March 2025, legacy respite care benefits expire for all families with level of need 1 or 2 dependents. If during the recertification process, your dependent is identified as a level of need 3 or 4, you will receive respite care benefits at the new standardized rate. Again, 1 March 2025 is when adult EFMP EFM family members who are determined to be level of need 4 will become available. So when we look at new families, the application process is the same, utilizing the family support coordinator as our primary point of contact. If during the initial application for new families, it is determined the dependents are a level of need 1 or 2, they will not be eligible to receive respite care. If identified as a level of need 3 or 4, they will receive legacy benefits, which is the 40 hours and the sibling care until 1 March of 2025. Again, come 1 March 2025, for all families, rather legacy or new applications, they will receive the new standardized benefits. An adult level of need 4 dependents will qualify for respite care. Okay, next slide, please. So as we talk about this application, there's been some confusions about what is this application? What does it consist of? Can you go to the next slide, please? The medical branch is responsible for determining the level of need based upon the submitted application. The application consists of the family demographic form as well as the need assessment form. The family demographic form is completed by you and contains contact information and information needed by the services team for provider placement. We were notified of a glitch in the demographic form with the toggle options. That has been corrected and an updated form is available on DAF Family Vector or by contacting your installation family support coordinator. The needs assessment is completed by your dependent's medical provider. We've gotten a lot of questions about what is a medical provider. Can it be a nurse practitioner? Can it be a specialty care provider? Any licensed provider can complete the form. This includes physician assistants, nurse practitioners. It can be your dependent's specialty provider. It does not have to be their primary care provider. It is important that the form be as detailed as possible, though, so we are accurately able to determine the level of need. In addition to this form, you are encouraged to submit any supporting documentation. However, it is not required. One thing we have had in frequently asked questions is the diagnosis does not determine your level of need. It's the supporting medical care or supporting services that determine the level of need. Although the standardized level of need rubric is not releasable, the needs assessment was created to mirror the standardized level of need rubric used by the medical branch. The needs assessment form should include a provider signature that contains their credentials and or stamped by the medical provider. If seen within the military treatment facility, the provider may also digitally sign the form. If we are unable to verify that the form was signed by a licensed provider, it will be returned for completion prior to us determining the level of need. As we stated in the previous slide, the application package is available through your installation family support coordinator or the DAF Family Vector website. Once completed, it comes to the EFMP central cell, and your family support coordinator will relay the level of need determination back to you. If you are a new family, once the level of need determination is made, the Air Force Services team will contact you to begin provider placement. Next slide, please. This slide contains several key dates. I'm going to focus on the yellow and red dates. So from October 10th through 15 January 2024, the recertification process has started and will be conducted. All applications for recertification must be submitted no later than 15 January 2024. If the recertification package is not received by 15 January 2024, respite care services will be suspended on 1 March 2024. Families can still apply for respite care services after the 15 January 2024 deadline. However, the services may be interrupted until a level of need determination can be made. Again, we don't have a clear timeline on how long it will take us to process applications, but the level of need determination will be communicated back no later than 1 March 2024. All existing families who recertify will continue to receive legacy benefits until 1 March 2025. The new standardized benefits will be effective 1 March 2025. New families can apply for respite care services at any time. The level of need rubric and corresponding level of need hours will be utilized come 1 March 2025. Again, if you are a level of need 3 or 4 and you are a new family applying, you will receive legacy benefits until 1 March 2025. Your EFMP Family Support Coordinator, again, is your primary point of contact for all things regarding the recertification or to apply for respite care services. Our EFMP Respite Care Org Box is highlighted in blue. If you email our Org Box, we will answer any questions you may have or forward to the appropriate point of contact. For all questions regarding providers, scheduling, payment, those will be sent to the Air Force Services Org Box listed down at the bottom. Our DAF EFMP Facebook page and DAF Family Vector will contain resources, information regarding respite care, and the forms required for application. So we know this is a lot of information being provided. We have posted frequently asked questions to our DAF Family Vector website and are adding to these as more questions are received. I have a few on the slide that we're going to talk to. The first one is, where can I get a copy of the rubric? The DoD standardized rubric is not releasable. Again, the EFMP needs assessment, the respite care needs assessment form, was created to mirror what is used in the rubric. Who completes the respite care needs assessment? Any licensed provider, so it can be a nurse practitioner, primary care, specialty provider. Each EFM requesting a level of need determination will require a separate respite care needs assessment. So each dependent needs to have their own form. What if I don't recertify my eligibility for respite care? Again, all families must recertify by 15 January 2024, or benefits will end on 1 March 2024, and you will have to reapply. I'm new to respite care and I just submitted my first application. Am I eligible for legacy benefits? If you are determined to be a level of need 3 or 4 as a new applicant, you are eligible for legacy benefits. If determined to be a level of need 1 or 2, you are not eligible for respite care benefits. What happens if a provider quits due to the reduced hours and or dissolution of the sibling care? As Ms. Thompson stated, leadership is meeting with providers in November regarding program standardization. We recognize the impact to them as well. If there is a gap in care and your provider does quit, please reach out to the FCC or ECC program managers to help with finding a new provider. Again, this is just a small list of our frequently asked questions, and I'm sure we'll get more today. Please continue to check DAF Family Vector for additional resources. Over to you, Ms. Hern.
Thank you so much, Ashley. We really appreciate it. Team, Ms. Martinez is our respite care liaison and is doing a fantastic job of taking care of this process change and ensuring that that level of need determination is complete, timely, and gets back to you all. What I really want to do now is, if you'll go to the next slide, there we go. Let's go over our resources one more time. We want to put these up on the screen so you always know how to contact us. Here at the Central Cell, you can reach us through the Total Force Service Center. EFMP families will select option 8 when calling the Total Force Service Center, and they will warm hand you off to the Central Cell. But don't forget that base level resource is your Family Support Coordinator, many of which are on the line today, but certainly reach out to them with your questions and concerns and know that your base level POC is always there to assist. All of our different email addresses here in the central cell are also available to you. The respite care is highlighted in blue for those specific questions concerning respite care. Social media, we're out on Facebook. So if you are on Facebook, you can certainly join us there. You can direct message us. We monitor that every day and are happy to correspond with you in that manner if that is best for you. Our DAF Family Vector website, please, if you have not already gone out there, we highly encourage you to visit the website and learn all things about EFMP, but certainly realize that we do have a specific area for respite care information, and you can receive all of the information you're getting today on that website. So we'll post slides, certainly build out our FAQs based on the questions that you ask today. Next slide. So we're going to open up the mics. We're going to open up the chat. Certainly, we hope that we've answered a large majority of your questions through the information we provided, but we certainly would love the opportunity to either clarify things or maybe answer something that we didn't touch on. So we look forward to hearing from you. What I ask is that you raise your hand, and when we call on you, you can certainly unmic and let's chat. The chat function is also open if you would rather use that. We have a few folks on the line who are answering those chat questions as they come in. So certainly that is the other way to get your question answered. We also are going to keep those important dates to remember up there for now in case you want to jot those down. But again, realize that after today's webinar, we will put the dates and the important slides out on DAF Family Vector for you. All right, so let's start. Let's see. I have Samsung SN. So if you're my Samsung with your hand up, we'd love to hear from you and meet you. Good afternoon.
Hello, it's Sean. So I have multiple questions, but each time I'll just raise my hand. But for the first one, if we are given level 1 or 2, is there going to be a process where we can fight it or try to get it changed or get more information? And if that is true, then what is that going to look like?
Great question.
Yes.
Ms. Martinez will answer that for you.
Yes, sir. So we have 2 different processes in place. So we have a reconsideration process. If you feel that the level of need that we have determined is not fitting for your dependent, you can request a reconsideration process by going through our org box or contacting your family support coordinator. If you are going for a reconsideration, we do ask that you submit additional documentation for us to review. And that, again, supplemental documentation could be an MFR from your provider, a DD form 2792, anything that you think will give a more accurate depiction of your dependent's needs. On the flip of that, if you agree that your dependents do not have a level of need 3 or 4, but you have an extenuating or a hardship in your family, we encourage you to apply for a exception to policy. We have a panel that will meet for that to review those. Some examples of those are maybe the sponsor is going to be deployed and there's a short-term hardship, or there are multiple level of need 2 dependents. So things like that we will take into consideration and encourage you to apply. And again, that is through the Respite Care org box.
Thank you.
Thank you, Sean. We appreciate the question. Okay, so we have Lieutenant Colonel Jacques. I can see DEW, so I'm sure hopefully you know who I'm calling on, sir.
Hey, good afternoon. This is Jacques. I appreciate the opportunity. So if we've got a kiddo that's level 1 autism, which is I would say higher functioning, I take it that would not qualify as a moderate on the need. Does that sound about right?
So it's hard to say without seeing everything. So again, it's more than just a diagnosis that determines a level of need. It's any supportive care. So that can be educational support in the school, use of ABA, use of speech therapy, use of occupational therapy, any other diagnoses, any medications. So it's a big picture of what's happening for that dependent, not a specific diagnosis, if that makes sense.
Yes, ma'am. I do have the contact information for the specialist in my particular base, and I'll reach out. So thank you.
Perfect. Thank you, sir.
All right. Thank you, sir. Master Sergeant Shanker, the 388th Fighter Wing. How can we help you, sir?
Hi, I actually have Yeah, that's fine. That's fine. Thank you so much for all that information. I forgot my one question. Sorry, I'm doing rough housing supervision while I
Multiple
try to
things,
listen to you
right?
guys. Yes, you know. So the one question was just when is it appropriate to contact the central cell directly? I'm in close contact with my EFMP office, who I have a good working relationship with. But I find a lot of guesses and I don't know, an apathy with my FCC coordinator. So would it be appropriate to just reach out to the central cell and ask questions that an FCC coordinator is unable to answer? Like, how long should it take to get a list of providers, that kind of thing?
Ms. Garcia, are you available to answer that question?
So it's going to depend on what your information is. As they talked about in the beginning of the briefing, the family support coordinator is the person that is your contact person. However, if you're wanting to know how long it will take for a list, then you should contact us at the Air Force Services Center.
Okay.
If we made a mistake and we didn't give you a list, then please follow up with us. And she provided you the org box for the Air Force Services Center. So you are still reaching out to the Air Force Services Center. You are still sending your scheduling to the Family Child Care Community Child Care Coordinator. That hasn't changed. We're still operating the program until 1 March 2025.
Okay.
And were you a parent or were you who was I speaking to?
Parents, and
Okay.
As a parent and the active duty sponsor.
Okay, great.
My question was really because you guys just mentioned deployments, and we have a lot of spouses that are getting upset because their 60 days go by, they're still waiting for their list of coordinators that they can communicate with. So they're like, my deployment's almost over by the time they're in touch. So I think their expectations aren't being managed. Like, how long should they have to wait?
So are they looking, so when you're talking about deployment and you're talking about respite care, are you talking about their list of providers that can serve them? Are you talking about you don't know who the family child care or the community child care coordinator is, or they don't know who the family support coordinator is? So I'm kind of confused.
Their list of coordinators that they can liaise with, like they get their name turned in and they're waiting for the list of folks that they can say, do you have availability to watch my kid for deployment care? So they're halfway through the deployment and they still don't have that list of care options. And I'm like, well, I can't help you with that. Just here's your resources at the base, make sure and contact them. But it sounds like they're exhausting them and not getting any communication.
Can you tell me what installation you're at?
At Hill Air Force Base.
Okay, so I can reach out. I mean, if you'd like to send us, what would be great is if you could send us a list of the families that have that concern at Hill. If you could send it to our box, then we can do some research and see where it's at. So we have one to two people that specifically work for Hill. And I know that Hill's coordinator moved over to the school age program. Not that that should be an issue for you, but let us at the services agency try to support you. So if you could send that to the box that's on that slide, or Linda Gonzalez, she's on. If you could send her an email, then we can do some research and see if we can help those families.
Okay. If you want to send your email to me right now, you can instant message me here in the chat.
Okay. And I'm sorry, that's more for some deployed families that have been having the same issue. I have what I think is going to be a super quick question, but I will stay on the line and let another family go. So it's kind of crazy here.
Yeah. So send Linda your email and she'll reach out to you tomorrow, and then maybe we can work that out. So deployment orders shouldn't take long for us to review and approve. And if they're able to use, they should, I don't know why that's taking. So if you could just work with Linda, she'll be able to help you. Okay. Apologize for that.
Okay. Thank you.
Thank you, ma'am. All right, Miss Holly, how are you today, ma'am?
I'm doing well. How are you?
Good, thank you. How can we help you, ma'am?
Yes, I wanted to know how is the Air Force going to advertise to respite care providers better in terms of there's not a lot of respite care providers available to families. So is the Air Force going to do better in advertising this as a job so families can actually get providers?
Thanks for that question, Holly. You betcha. Certainly, since post-COVID, certainly there has been far less providers than we had going in. But the Air Force is looking at how and the options at hand as we move into the future of respite care. So as Ms. Garcia explained, the Department of the Air Force will continue to manage the program through 1 March of 2025. And we are currently, with the help of our policy partners, Ms. Thompson, looking at different options and different providers to be able to support our families with a larger provider base. So certainly, as we walk through these changes, please know that we are definitely looking at how we present respite care to our families 1 March 2025 and later. So more to come.
Thank you.
All right, Mr. Hunkins, how are you today?
Well, good evening, good afternoon. First
Good.
time caller, long time fan here. Hey,
Yes, sir.
mine is not a reserve specific question. It's more in line with the adult EFM. And I think that's phenomenal that they're bringing that online with across all the branches now. But would it be, as far as the requirements, same type of thing of an adult child? Hey, the member needs to prove, 51% of financial. I'm drawing a blank now on the verbiage, but basically, thank you. Yes, thank you. Where they would then, that adult parent, whomever, would be then in DEERS, so they would have to show up in DEERS. Because, and the reason I ask that is I know lots of active duty members that are taking care of a parent that there is no quote unquote benefit really for them to have them in DEERS, because they might just, there's no real benefit, but this would obviously be something that may entice them to pursue getting them in DEERS. Over.
Yep. We'll definitely provide some clarification. Ms. Ashley, you can go first, and then Ms. Thompson, we'd love for you to join in.
I will defer to Ms. Thompson regarding the policy part of that.
And I'm sorry, because I was looking at one of the questions in the chat. So can you restate for me? You were talking about certainly that you're happy for, and we are too,
yeah, but
for the opportunity to provide respite care for adults.
But the requirement for that adult, would they still, the military members now have to, if they are not already, had gone through the process to get them assigned or proven in the system as a dependent showing up in DEERS?
So it sounds to me like you're talking about the incapacitated adult. Am I correct? Is that's what we're talking about, right? Where you have them listed in DEERS. We have, I've had an opportunity to review some draft ODs that are coming in on the determination of eligibility and that kind of thing. It does look to me like you would go through that process. The draft OD that we looked at was talking about how that process would work, whether or not there would be changes to the current process where, you're establishing the financial responsibility. They were trying to streamline that. I don't really have, I don't feel like a real firm answer for you, or confident that everything is as firm as it needs to be. So I want to make sure that, again, that we have your information. Appreciate, because this is a great question and it affects more people than what you would think. But I look forward to the opportunity to get back with you and provide you with the most up-to-date information and the most accurate that I can about how that process would look. Again, other than saying that I know that they want to streamline that, they want to make it as easy as possible. But you and I know that sometimes the intent is to make it easy. But the the experience on the user end is not as easy as what we had hoped. So again, please allow me to get back to you. And as we get more information, that is also something we can update on DAF Family Vector.
Awesome. Appreciate y'all. Thank you. Over.
Absolutely, sir. Thank you.
Thank you, Ms. Sharon. Could either you or Ashley provide a couple of examples of adult EFM situations to help our families kind of wrap their arms around what we would likely see?
Well,
Yes,
I know
ma'am.
one example I used this morning from Ashley, I'm sorry, was the spouse with cancer. We had certainly used the incapacitated adult. Ashley, do you have others in mind that you can think of off the top of your head?
So the ones we've seen most commonly through our ETP has been the incapacitated adult, but really any chronic condition or medical condition with significant needs would qualify. So it wouldn't just have to be cancer. So any, again, high needs medical condition. And I did see a comment somewhere in the chat about mental health. And I do want to take a moment to address that kind of with this. Again, the rubric does take into account mental health diagnoses. There was concern about if it did or did not, and it does. And so there's categories within the needs assessment that also speaks to that.
Thank you, Ashley, for answering 2 and 1. We appreciate you. All right, Miss Elena, we'd love to hear from you, ma'am. Good afternoon.
Sorry. Okay. Can you hear me?
We sure can. Yes, ma'am.
Okay. Sorry. I have not used Zoom before in a very long time. I have a few questions that I've been trying to get answers from other questions as well. One of my questions is obviously the lack of sibling care, and you've mentioned other resources may be available. Our primary need, a lot of what we use our respite care for is because our EFMP member has so many therapies and doctor's appointments and things like that, that we can't take siblings along to. Will there be, are we allowed to pay the providers for the siblings? How will that be managed? Because otherwise, other than the occasional self-care time for my husband and I to go out, respite care, we really need the sibling care. Otherwise, it isn't all that beneficial to us.
Yeah, we certainly agree with you. And I'll tell you, ma'am, when we walked into the meetings at DOD, Miss Thompson was carrying the flag of we want to continue sibling care. As she mentioned, we were the only service that currently had it. And as we sat around the table with the different services, that was just something that we could not get the other services to buy into. Of course, funding and cost is certainly one of the big reasons. But certainly, sibling care is one of those things that we know you're going to get to keep, right? If you currently have it, you'll get to keep your respite care benefits through 1 March 2025. Depending on the future use of the respite care program, and do we use a contract? Do we continue to do it internally in the Air Force? But what that future state is, we'll work through and also advocate for at least the opportunity for our families to pay that respite care provider out of pocket for those costs for the siblings. But sibling care just was something that the other services could not match in funding. And so although we advocated very heavily for it, it was not something that we were able to come through with. So fully understand the challenge that you're facing. But through 1 March, that sibling care will continue, and we will keep you all posted as we move forward with how we'll provide respite care to our DAF families 1 March 2025 and later.
Will those benefits be continued until 2025 through PCSs? Because I know we'll be PCSing in the middle of all of this.
Absolutely.
So will we be able to get, okay.
Yes, ma'am.
Everyone's mentioned that obviously Care Aware is managing it now. And we've been here through that transition and lost a lot of providers that way, I know. Who's going to be managing the program now? Because it sounds like Care Aware is being phased out. Will it be military that's running it, or civilian, or how is this? Who's going to be in charge of the program?
So today, Ms. Garcia is the lead of that. The Department of the Air Force runs the respite care program. We stopped utilizing a contract back in 2019. And again, the Services Center, Ms. Garcia's team will continue to run our DAF respite care program until 1 March 2025, when the Air Force transitions to a new provider. Again, that's in the works as to who exactly that provider will be.
But do we know, will it be basically government run or civilian? Because we saw how the last transition went, and it sounds like they may not have someone in place now, which worries me about helping with a smooth transition. If you're a year out and there isn't someone in place to take over starting this spring for all the services, and they'll be managing all the branches?
2025. So
Yeah.
this transition will take place in March of 2025, which is 18 months away. So
I thought that
as
was just for those that were grandfathered in, basically.
No, for new
Okay.
families are grandfather, the Department of the Air Force Services Agency will continue to be the provider and help our families match to a provider. 1 March of 2025 is when we hope to transition to a new model, and whether we go back to a contract and what contract that may be certainly is in discussion. And we'll, as soon as we know, of course, we will definitely give plenty of time for a transitional timeframe.
And if I could add, on our plan, when we look at how we are implementing and how we're transitioning, we are allowing for at least 12 months for us to work the contract so that it will be a very smooth transition, that we'll be able to update our families, that we will have selected what we think will provide the best service for our families. So there is a lot more to follow. It is something that is on our radar. It's not something that's that we're going to think about when we get to it. We are already working that.
And adding, since talking about adult care being available, what age? Because I know before, I feel like it was like at 12 years old or something, respite care ended for the EFMP member, or maybe it was their siblings. I can't remember for sure. So what ages are eligible for respite care in general now?
Ms. Gonzalez, Ms. Garcia, do you guys want to take that?
Yeah, so currently they're eligible for respite care until they age out at the age of 19.
Okay.
So we have done some exception to policy. We have worked with Ms. Martinez in the panel, and we have some people that have received exception to policies. So, and they have, because they aged out. But
Okay.
When they turn 19 is when they age out of the program. Yeah.
Okay.
And then siblings, do siblings age out of sibling care? Ms.
Sibling
Garcia?
care, yes. When they turn 13, they are no longer eligible for sibling care. Thank you for reminding me about that. Yeah.
And because we see our providers when we can, and I'm sure this will be discussed, are they aware of the changes coming, or have they not been?
So some of the providers
are
aware of it, but we are going to do a briefing for them in November. So that is will be posted soon to them, and that information will be provided to them. So we are working on a date so we can get that information to them. So yes, we are thinking of them.
Okay. And I have one last question, and I'll pass it on because I'm sure there are others waiting. When you talked about those that are determining the level of needs and what all the care levels are these medical professionals, or how are they trained? What are their qualifications to be determining those medical needs? And are they going to be absolutely swamped by all of this?
Yes, ma'am. So we have a team of nurses and physicians that will be using what the needs assessment states to compare it to the rubric, the standardized rubric. So all of the information that we're putting into that rubric is from the needs assessment that your provider fills out. We have a very large team, and so we have been preparing to start the adjudication of these forms, as well as OSN is doing a training for all providers who will be utilizing the respite care needs form to make sure we all are using the same practice and it is standardized.
Mm-hmm. Okay. All right. Thank you.
Thank you, Elena. All right. Next case. Good afternoon, sir.
Hey, good afternoon. Can you guys hear me?
Yes, we sure can.
Yeah. Thanks so much for what you guys do, for putting this together. Just had one quick question. What is general success rates or the inventory for respite care providers as kids continue to age? Like, for example, you've got a 15-year-old or a 17-year-old. What does that population of providers look like, and what can we expect as our kids continue to age?
Ms. Garcia, Ms. Gonzalez?
I don't understand your question, sir. I'm not
Yeah.
sure. Are you
Yes.
talking about our current children?
So basically what I'm saying is if I've got a kid who's 16 or 17, what does the provider pool in general look like to support that age group compared to a younger kid or a 5 or 6, 7-year-old? It's a totally different ask for providers. So just trying to get a feel for what do you guys have support now, and what we can look forward to, because it seems like to me it would get increasingly difficult to find folks as your special needs kids require more support as they get older. Did I clarify for you?
Yes, it sure does. However, unfortunately, I don't track statistics like that in that manner. I can say that, we really do track it by the installation. The installation's needs, not really by the age of the child. But families I would like to remind them, they are able to, if they find somebody in their community that it wants to be a respite care provider, we can get them vetted through the process and get them on board for them. But I don't have the statistics for, is it challenging for us? That's kind of an interesting question. I haven't heard that it's challenging to have providers, care for older children versus younger, because we use some of our certified providers at our installations as respite care providers, and then we have many respite care providers in the community. So they really have a varied background. So I haven't heard that's a challenge for us.
Okay, thank you so much for the question. It was just a general something I thought I'd throw out there. I know it's hard enough as it is for our kids that are younger to have a full list of options for providers. So I was only imagining it would get harder. So it might be a statistic that I would recommend you guys follow, just for this total, with regards to the total, overall success or a reliability program. But
and the parents actually, they interview the providers and they select the providers. So I haven't really heard from them that that's been an issue, that providers haven't wanted to care for older children. I can say that, but they are the ones that are integral part of that process. They interview providers, we give them a list, and they go down the list, and they're able to set up appointments with them and make a decision of who they would like to care for their children.
Thank you.
Thank you, sir. All right, Laura, you're up.
Hey guys, can you hear me?
Oh, Mr. Tate.
Sorry, I'm not Laura. I'm using my wife's login while she watches the kiddos. So first off, appreciate all you guys are doing. I apologize if my question comes off as being a little bit negative. I know nobody on this call woke up and decided, hey, this would be a great idea to do. So I'm not trying to pick on you guys, but we've all been in situations before where we have care packets or care plans returned or referrals returned because someone didn't cross a T, dot an I, use the wrong code, something like that. And I mean, sometimes it goes through multiple iterations. You can have a lapse in service while you're trying to get the paperwork through. I guess my question is, how do we make sure that that's not going to happen with these respite care recertifications? That how do we smooth out any administrative hiccups, I guess?
No, you bet, sir. So that is one of the main reasons that we are asking families to get it done by 15 January, right? So go ahead and make that appointment with your provider. We know that certainly sometimes that can take weeks and sometimes that can take 2 months, right? So we absolutely want to give you enough time in order to make that appointment and get that application completed and turned into us. Again, 15 Jan is the target date. We know if we get it by 15 Jan, sir, we're going to get you a decision back before that 28 Feb deadline. Our nurse and physician team, Ms. Martinez, will ensure that that happens. If it's after 15 Jan, then certainly there is a chance that could happen, right? But still, we'll still work to get that response back to you as soon as possible. But as someone mentioned, right, we still do all the family member travel clearance here within the EFMP Central Cell, and we are postured. We are absolutely postured to handle this respite care revalidation workload. But starting early is what we really need from our parents to make sure that we don't have those issues.
Okay, copy all. Thank you.
All right, Miss Erin, how are you today?
Good. How are you guys?
Fantastic. How can we help you, ma'am?
Well, thank you for all that you're doing. We are extremely grateful for Respite. We have a daughter with a lot of medically complex needs, and we've been fortunate to take advantage of two things that are currently in place. My husband had a 12-month unaccompanied over a year ago, and we got that extra 16 hours a month, I guess, deployment hours. And then more recently, we were granted extra hours because I had a hysterectomy, so I was unable to lift my daughter. And so are both of those things going away with this new organization?
No, you still have the opportunity to apply as an exception to policy for things just like that. Ms. Martinez can probably expand more, so I'll turn it over to her.
Yes, ma'am. So the exception to policy, similar to what you did previously, will still exist. We will review case by case if there is a need for additional hours, and we'll be able to grant, again, even those families that are not determined to be a level of need 3 or 4, but are maybe a 2, but have a similar situation, a medical procedure happening or things like that, are encouraged to apply for exception to policy. We want to support families as best we can. And we just need to know about the extenuating circumstance.
So will the extra deployment hours be an exception to policy? There won't be like a standard number?
Ms. Garcia, can you answer the deployment hours?
So that is one of those future processes that the EFMP cell will be making a determination on. Now, you will able to, right now you're able to use your respite care provider because they're under the Air Force Services Center. However, that's to be determined because they will no longer be under us when March 2025. So could you actually go and request deployment childcare with the family childcare coordinator, the community childcare? Yes, you could. However, it wouldn't be able to be done in your home. It would have to be done with a certified provider, and there may be some things additional things you need to do. So you're still eligible for that because your husband's on deployed to a contingency operation. So those are kind of things that we're going to address in the future when we're planning out this process as they take over the transition. But that could be an exception to policy, or it could be that you use one of our certified providers. So that may depend. Every probably family may be different too. So, but we'll definitely be putting that down in some guidance.
Okay, thank you. I appreciate it.
Dawn, I wanted to say something. I think it's important to remember because I think sometimes we get confused about deployment care, and some respite care families kind of view it as additional respite care hours, and they're really not. They don't have anything to do with respite care. It's a separate program that Child and Youth Programs has to help to support families. And it's been one that our respite care families didn't, kind of utilize before when we had the contractor. And so we've let them know about it, and more people are utilizing it. So it's a different program than respite care. But like Dawn says, if hours are needed for deployment childcare, then you can definitely go to the family childcare, community childcare coordinator to find out more about that.
Great. Thank you so much.
And for that connection with your family support coordinator at the base really helps, because the family support coordinator absolutely will have information on all of those different childcare programs and can connect you with that FCC. So certainly a great opportunity to get information through your family support coordinator. But thank you for those great questions. Certainly gave us an opportunity to really hit that exception of policy clause hard. So thanks for allowing us to do that. I will say that it is 6:01. We are happy for anyone who still has their hand up. If you'll go ahead and just put your question in the chat, we'll get you an answer. Our folks will stay logged on here for probably the next 15 or 20 minutes to make sure that we answer all the questions that have been submitted. Again, if we don't get to your question, leave your email address and we're so happy to connect with you. Or you can absolutely just email the org box, right? You see it up there on the screen right now. Email your question to our org box and we will get you an answer back. Thank you all so much for joining us. Again, this is certainly a difficult transition. We want to make it smooth for our families, but realize that there are challenges with this. The Department of the Air Force will work hard to give you the assistance that you need and certainly help you walk through the journey of the transition. Without further ado, we truly appreciate families and all of the base level stakeholders that have joined us. Again, thank you for being a part of this conversation. Your feedback is always welcome. Again, please join us on Facebook. Email us. We are happy to connect and answer your questions. Sean, I know we didn't get back to you, but please drop us an email, sir. We'd love to finish answering all of your questions. You guys have a great evening. And again, thank you so much for being a part of this conversation.
Thank you everyone for joining us today. We want to make sure that all of your concerns are addressed and all of your questions are answered. So please, if you right now, since you're getting your last minute questions into the chat, please be sure to add your email address, like Ms. Hern said, so we can reach you after the session. Also, remember, please browse our DAF Family Vector website for updated content regarding the DoD Respite Care Standardization program process, and for a copy of the slides and videos. They will be posted on the DAF Vector website. If you have any questions, the workflow is right there on the slide. Please make sure you jot that down and ask us. You'll have a blessed day and a great rest of your day. Thank you.